Hello, everyone. Welcome once again to our Wellness Wednesday. Today, we're going to be talking about how to optimize, or should I say, what are optimal blood sugar limits. I want you to understand post meal or postprandial meal numbers and the effect that high blood glucose levels can have on your vascular system. Now, blood sugar is the amount of glucose that is in your blood. Glucose is a type of sugar that your body uses for energy. When you eat, your body breaks down the carbohydrates into glucose, and then the glucose enters into the bloodstream, and with the help of insulin, it is transported into your cells. That's the best case scenario. Now, maintaining optimal blood sugar levels is crucial for overall health, especially in individuals who have diabetes, whether it be type 1 or type 2, or prediabetes. Now, fluctuations in blood sugar, particularly after meals, can have a long term impact on your health and contribute to the development of many different types of complications. Today, we're going to explore the ideal blood sugar levels that you should have after your meals and the acceptable amount of increase in levels and the time that is required for levels to decrease and the threshold at which damage can occur in your blood vessels, particularly in the eyes. Now, let's first talk about ideal blood sugar levels after meals. Now, after a meal, blood sugar levels naturally rise. So don't freak out if you test your blood sugar and you're noticing that it's rising, because due to digestion and absorption of carbohydrates, you are going to see that increase. Now, maintaining these levels within a healthy range is essential to prevent complications. The American Diabetic Association recommends the following blood sugar levels for people who have diabetes. Before your meal, it should be between 80 and 130 milligrams per deciliter. After your meal, according to the ADA, it should be less than 180. Okay? Now, that is when we are looking at things from the scope of the American Dietetic Association. This does not, however, reflect optimal blood sugar ranges. What we really and truly need to aim for are optimal blood sugar ranges, which are as follows. Within 2 meals after a meal, within 2 hours after a meal, your blood sugar should go back down to between 90 to 130 milligrams per deciliter. And then within 3 hours after a meal, it should go back down to between 70 and 100 milligrams per deciliter. Now, keep in mind, like I said, that your blood glucose will naturally increase after a meal. After consuming a meal, your blood sugar will typically reach its peak within 1 to 2 hours, and then it'll start to come down once again. In healthy individuals, the increase is relatively modest and returns to pre meal levels within a few hours. However, for people with diabetes, the acceptable increase in blood sugar levels may vary depending on your specific treatment plan with your healthcare provider and other individual circumstances. According to the ADA, remember that the target post meal blood sugar levels should be less than 180 milligrams per deciliter. However, some studies suggest that a more conservative target, like I said, the optimal scenario is that it should be no higher than 140 milligrams per deciliter after meals. And this gives you lots of benefits. In particular, it helps to reduce the risk of cardiovascular diseases and microvascular complications. Now, you may be asking, again, how long does it take for blood sugars to decrease? Eh, well, it takes about 2 hours for the blood sugar levels to get to a peak and then to start to decline. However, some people may see their blood sugar levels return to normal more quickly. or more slowly. The time required for your blood sugar levels to go back to your pre-meal level varies depending on a lot of different factors, including how much production of insulin occurs in your body, also the insulin sensitivity of the cells, whether or not you have diabetes, the composition of the meals, your physical activity, and in general, you should go back to your normal pre-meal level within 2 to 4 hours. So, again, within 2 to 4 hours, you should return to your pre-meal level. And that is why I always encourage my students to have a 4-hour gap of time between meals. In the United States, we're constantly stuffing our faces, and so we're constantly triggering our blood sugar levels to increase, which creates a significant stress to our systems, and it increases the risk of cardiovascular disease and microvascular complications. All righty, so keep that in mind. Now, what type of levels does damage occur in your blood vessel? Well, the damage to blood vessels occurs when your blood sugar levels remain consistently high. Remember, that's why I said gap of 4 hours between your meals so that your blood sugar levels have an opportunity to return to the pre-meal levels. If you consistently keep it high, that increases your risk of damage. Some of the damage to the blood vessels can lead to a number of health problems, including heart disease, stroke, blindness, kidney disease. I'm going to speak specifically about the eyes right now, because consistent blood sugar levels that are higher than 140 milligrams per deciliter during fasting and post-meal can lead to long-term complications, including damage to the blood vessels, the microvascular and the macrovascular complications. In the eyes in particular, you are susceptible to that damage that occurs to the retina. That results in what we call diabetic retinopathy. It is the leading cause of vision and blindness in our country. Research published in medical and scientific journals have shown that the increased risk of microvascular complications, such as diabetic neuropathy, increases significantly when blood sugar levels are poorly controlled over time. In Landmark Diabetes Control Complications Trial and its follow-up study, it demonstrated that maintaining tight control over blood sugar levels is significant in reducing the complications in both type 1 and type 2 diabetes. So, in conclusion, maintaining optimal blood sugar levels, particularly after meals, between meals, is vital, especially for individuals with diabetes, to prevent long-term complications. The ADA recommends, the American Dietetic Association recommends that post-meal sugar should be less than 180, but some studies, and I go in alignment with this, say that we should be aiming for levels that fall below 140 milligrams per deciliter. And this will give us additional benefits and reduce our risk. Blood sugar levels typically peak between 1 to 2 hours after a meal and can take 2 to 4 hours to decrease back to their pre-meal levels, depending on a variety of different factors. So, in general, your blood sugar levels should not rise more than 30 to 50 milligrams per deciliter after a meal. So if you compare your before meal levels with your after meal, there should be no more than a 30 to 50 milligram increase. Keeping your blood sugar levels within the target range is important for your health. And if you have diabetes, I strongly suggest that you work with your healthcare professionals to develop a management program. And for me, what I say is to develop a disease reversal program that is right for you. I hope this information has helped, and I look forward to seeing you again next week for our Wellness Wednesdays. Bye.